solid tumor. It's surrounded by a bunch of fibrin. And tumors can only, we'll get to this in a minute, tumors live mostly off anaerobic glycolysis. They're eating sugar, getting their energy from chemical reactions that don't involve oxygen. The consequence of that is that they make a lot of acidosis. So you have a very acidic environment right around the tumor. We're going to go through this in the later slides, so you don't have to remember this, but in that milieu, that acidic milieu around the tumor, things grow. And if that milieu becomes colonized with progenitor cryptocetes, then you are basically coating the tumor with human chorionic gonadotropin, HCG. The body, for as long as there has been sexual reproduction, the body has been programmed that if something is coated with HCG, for example, a fetus, you may look at it and say, that's not self, but I'm going to leave it alone. So males and females leave things alone that are painted with HCG. So it's just another way that the body that the tumor evades immune surveillance and immune action. So, and what does it do with non-self cells that are coated with HCG? It ignores it. It leaves them alone. And what Dr. Livingston did is she would just make a vaccine to the progenitor cryptocetes, and there are still labs around that do this. This isn't a dead technology. This can be done in a rather backwards way. Some of the stuff that Brzezinski's doing down in Texas is basically similar things. He's making vaccines against some of these things. Not to give away any of his secrets. I mean, these are things he talks about, but these are, in the community of people who are trying to treat cancer using things other than chemotherapy and radiation and surgery, this is a very useful adjunct. But I included in this talk, not to say everybody needs to go do that, but just to understand, how does cancer set up shop and survive in the presence of an immune system that would normally want to kill it. Now, pH, glucose combustion occurs, and I had the slides a little later, but cancer cells only eat sugar. That's just kind of the bottom line. Hydrogen ions are very acidic by definition. The concentration of hydrogen ions is the definition of pH. And because of this acidic environment, it becomes very hostile for anything, but it also starts to, when the tumor becomes big enough, that acidic environment actually starts to digest surrounding cells, and those become food for the tumor. And cancer can only live in this acidic microenvironment, but it lives very well there. So this acidic microenvironment is also one of the ways that the cancer cells avoid immune surveillance and avoid the body's defenses. And there are some so when you hear about, and again, I include this, when you hear about the importance of pH, yes, total body pH is really important for health. But the pH of your saliva or your urine isn't, and the things you would do to correct that, isn't going to touch the pH around, in the immediate environment around a tumor. There's some specialized things you have to do for that. And this was Otto Warburg. He won the Nobel Prize in 1931 for the discovery that tumor cells rely on glycolysis for energy. He actually went on, he set up a number of clinics in Europe and had a very successful run doing alternative treatments of cancer, although he was hounded, persecuted, and really life was made miserable because he was, even in the 30s, going against the grain with this. But the Japanese have shown, a normal eukaryotic cell, the normal cells in our body, 2 receptors for glucose. Tumor cells, 30, 40, 50, even 60 receptors for glucose. And so if you suggest to your patient that, and I was taught this in the first 6 weeks of medical school. Every medical student is taught this. Doctors forget. And so if you suggest to your clients, you've got a tumor, you've been told you have a tumor, quit eating sugar. That includes don't eat fruit, don't eat sugar. Keep your intake of sugar down below 15 grams a day or less. I have seen people, their tumors just stop growing. It is one of the cheapest, easiest, most effective things you can do for someone. And they'll say, well, my oncologist says there's no proof that not eating sugar, which is a load of horseshit. Okay? I mean, just tell them to go to the Nobel website and read this and then read more about Warburg. People may not like what he did, but nobody argues with the fact that tumors only eat on an oncocell. How a tumor attracts blood supply. Because most of the glucose is going to come from the blood, they need blood supply, even though tumors aren't prepared to grow their own. So wherever the tumor touches smooth muscle, it draws in blood supply. That's called angiogenesis.